Hello and welcome back to the Dental Realist Podcast. I am one of your hosts, Ryder Waldron, and I am here with Dr. Troy Stevens and Dr. Troy Neff, Dr.
Yes.
Marcus D. Neff. Troy,
Yes.
how are you doing tonight?
I'm doing good. Thank you. Long day.
Yeah, apparently. I can't remember anybody's name.
You can't remember anybody's name. That's right.
Marcus,
And
how
you've
are
only
you?
said our names a few times.
Like a few times, yeah. I got so flustered. I was so excited about this podcast.
That's right.
Marcus, how are you doing?
I'm doing great. It's been a long day, but it's been a good day.
Good. Let's see. Who did dentistry today? I think Marcus did. I'm pretty sure he did.
Yes, I did.
And Troy,
I
you
did not. No. How about you?
Yeah, I did some dentistry today.
Yeah,
I had
yeah.
a variety of dental topics to cover today in my office.
Awesome.
Yeah.
Yeah. That's good. You guys
Oh.
got to do it. Somebody's got to do dentistry.
Someone's got to do dentistry. It sure wasn't you today.
It was not me. No, I am actually in September. I'm changing my schedule, so that'll be good.
Sweet.
Oh,
To
nice.
0 days a week?
I will be working Monday through Wednesday, so
Every week?
every
That's
weekend.
kinda
Yeah.
nice.
So we got another associate coming in, so I'm gonna get him ramped up and be good. Should be good.
Sweet. So I had a question for you guys. This is a pop quiz. We get the most downloads for our podcast in the United States of America, which is probably predictable. Can you tell me where our second most downloads come from? Do you have any guess? It's very applicable right now to a country
Very
that's been in the news a lot for good
France.
reasons. Yes, France.
Wow,
our
good
second
job,
most
Marcus.
downloads
Really?
come from France.
It's
Yeah.
incredible.
Huh.
So if there's any French people out there, French listeners, maybe you
Yeah.
could email and tell us why you guys love the Dental Realist podcast so much.
Yeah, that's a
We-
good
I
call.
don't know.
Yes,
Yeah.
that's right. That's one
So,
language I
anyway.
don't know a whole lot of.
Yeah,
Marcus, you
I
speak some
agree.
French, don't you?
No, I do not.
Oh, I thought you did.
No. I took French in high school. I got an A. I took Spanish in high school. I got a D. And then I
Oh.
went somewhere and learned to speak Spanish.
You seriously took
And-
French in high school, though, huh?
I did. I took 1 year of it, and I got an A. But I couldn't tell you anything beyond merci beaucoup.
Yeah,
What about parlez-vous français? Doesn't that mean do you speak French?
something like that.
I
yeah,
think so.
I think it does.
I think that also means we surrender.
Well, we just lost all our French listeners.
Yeah, thanks a lot.
All right. Well, before we offend anyone else, let's get into our topic. So, Marcus, this is a topic you had. Why don't you tell us what the topic is?
So yeah, the other day you were we were all texting each other, and you said something about you had just referred a lovely child to a pediatric dentist, and that was a successful referral. And so I just half jokingly said, I think when we refer people to the specialist, we ought to get some kind of kickback, right?
Yeah.
At least a percentage of the total treatment plan.
Yes. Which
So
we have to
referring
probably
to specialists, that's and the role of specialist, that's kind of what we wanted to talk about.
And we probably have to acknowledge that getting a kickback is unethical and possibly illegal, and we do not do that. But we do get a treat every once in a while from specialists. I recently got a box of melted chocolates. So,
Fantastic.
Yeah.
That is a wonderful gift.
Yes. So appreciated, but not edible, really. So anyway, so let's talk about what is the role, Troy, of a specialist in your practice? Like, what do you consider the role of a specialist with you in dentistry?
Well, I consider a specialist to do stuff that is, out of the scope maybe of a general dentist. As far as difficulty level, like a difficult molar or, children that need to be sedated that I can't treat because I can't sedate children. Orthodontics. I don't do orthodontics, so that's a need for a specialist. There are super complex restorative cases that a prosthodontist is is a great asset for that. So I think there's a lot of need for them, and I appreciate the ones that I work with. That's for sure.
Yeah, it's always a real nice thing to be able to refer to an endodontist for like some terrible molar root canal or something like that. But
and I refer for
I'm
all
the same way.
molar root canal.
I do too. Yeah,
I don't do molar.
I don't either, and you don't either, right, Mark? You don't do any endo at all right now, I guess, which is nice.
Marcus doesn't do anything other
No,
than
I don't.
restorative stuff.
I don't do anything other than crowns.
Yeah,
Right.
which is awesome. So, Marcus, when you refer to a specialist, what is like the most important thing when referring to that specialist? Like their quality of work, how close they are to your office, whatever. What do you look for most?
I look for the guy that can bail me out and talk nice about me.
Yes.
Right?
That sounds funny, but that's totally.
Oh, no. I mean, I definitely look for somebody who's going to provide really good quality care. I mean, I want the patient to come back with an excellent result from whatever it is that they're having done, a root canal, an extraction, an implant placed, whatever that is. I want to build a relationship with somebody I know I can just trust that what I get back when the patient comes back to me is really high quality. And so it doesn't necessarily mean that specialist is going to be like really closely, like geographically close. But it is nice if they are. I mean, it's hard to refer somebody, 3 or 4 hours away for some treatment. It's nice if they can, within a reasonable distance, go see that person. So, which around here, and I think in Utah generally, it's not too hard to find a specialist within a reasonable distance.
Yeah, that is nice. If we didn't have that, I would probably feel more pressure to do more specialty work. But like for you, Troy, you have to, for endo, they have to travel a little ways, don't they, from you?
Yeah, the only thing we have here in town is orthodontics. We have a couple orthodontists come to town, but other than that, specialty-wise, everybody goes to Boise. So, it's interesting that a lot of people go there, for their medical doctors or whatever, the specialist medical stuff like that. But if you refer them for dental, it just seems like it's the end of the world. Oh, I got to go to Boise. Oh, I don't like driving in the big city. I don't like that's like Boise's not that big of a city, And they go over there, 2-3 times a week to eat or something anyway, or go to the movie because we don't have a theater.
As a profession, we've kind of painted ourselves into this corner. It's not unusual in medicine to have specialists and to have to go to multiple doctors for things. But in dentistry, we've kind of created this world where, we have specialists, but general dentists can do anything.
Mm-hmm.
Yeah, we're allowed to do anything, but go ahead.
Yeah, when you need your gallbladder out, you don't have your primary care physician do it, or appendicitis,
True.
But for whatever reason, dentistry crud, we got to do everything. You got to do everything.
Yeah,
and I guess it's nice to not if you have the skill set to do it, then that's fine. However, when stuff goes wrong, like for example, bad extraction, bad endo, something along those lines, what standard are you held to if you get sued?
Same as a specialist,
right?
Standard specialist. So you're gonna get some specialist is gonna go, hey, you shouldn't have done that one, and in a court you're gonna get mashed. You're gonna lose that battle.
Yeah, it is. One thing I hear complaints about, because I don't do it, like you said, I don't do any molar endo. Like extractions, I don't love to do extractions that much. I mean, one reason is that you could take 45 minutes or an hour to get out a bad tooth, and you're going to make, with insurance and stuff like that, you might make like $50. It's just not even worth the time sometimes when an oral surgeon could have it out in like 20 minutes. But the complaints I get a lot of time is like, somebody will come in for a toothache and have an abscess. And of course you have to get them on some antibiotics usually before you can do anything. And then refer them to the endodontist. Oh my gosh, I've got to go to a different office. Well, yeah. And what's the big deal about that? Because you're going to go to your house, you're going to wait a week, take your antibiotics, and then in a week you're going to have to drive to an office. Either you'll drive 10 minutes to my office or you drive 10 minutes to a specialist office. What's the difference between where you drive to and why you have to go to a different office? Because, if we're looking at it reasonably, we are referring them because we're doing the best for them and we're taking money out of our pocket. We could do that molar root canal. It might fail, but we're going to get paid for it. But we're sending them then to an endodontist because we're not greedy and we're looking out for the best for them. So that's one complaint I get a lot. It's weird.
Yeah, that's a good point. People think, oh, you're referring me to Boise. Why? It's like, if I had the capability to do it, for one thing, I would do it. Right. And why would I do it? It's not something I would want to do if I could do it, because then I could make some money doing it. And they should realize that, oh man, he must really want me to go there because it's going to get, I'm going to get the best care possible, or else he would do it himself because he could make the cash.
Yeah.
Sure. I have had patients tell me that I get a kickback or whatever. I'm like, no, that doesn't happen.
Yeah, I've heard that too.
I've never had
people ask me that.
I know. The kickback I get is a box of donuts, like once or twice.
Yeah.
Yeah, exactly.
Yeah.
Or a box of melted chocolates.
Like yeah. And I get a lot. I'm sure you guys do. I get a lot of treats like that from specialists that I don't even refer to, and so it's like, that's not going to make me refer to you because you give me some cookies or something. I don't know.
No, tell me I'm not the only one, but there are times when I refer, not because I couldn't do the procedure, but because the patient is, I don't want to see that patient. I'd rather let somebody else deal with the patient.
That's a great point.
That does happen. Not gonna lie.
Yes. Yeah.
But I mean, that,
especially like a denture case, man.
Yeah. Oh man.
Denture stuff. Yeah.
Denture cases. But it's probably not the best way to. If the only time I ever refer is when I have a pain in the butt patient, that's probably not going to build a good relationship with the specialist.
Yeah, that's true.
Probably not.
Real quick to help me out.
Yeah, but yeah, if it's a root canal on number 8 and you're just referring him because the patient's a jerk, yeah, the specialist probably wouldn't appreciate that too much. But he doesn't have to do it if he doesn't want to, I guess. But yeah, that's a good point, Marcus, because I mean, like I referred that kid recently, and this was for, let's see, I diagnosed a big cavity on I think it was on J months and months ago, and they didn't do anything about it. So then the dad wanted to get the tooth extracted. Well, the problem was there wasn't a permanent premolar underneath that tooth. So I'm like, dude, we got to get him to a pediatric dentist. And so that was one that it was just like, I'm not referring just because I don't want to do it. I'm referring because this is going to be the best, because we got to try to keep this tooth for this kid for a long time. But there are a lot of times that I'm thinking, yeah, if it was just that tooth on a typodont or something like that, yeah, we could do that, whatever procedure it was. But because this patient complains all the time after, they're calling for pain meds, they don't pay their bill, no thanks. I'm gonna send them. I have noticed that people are more prone to pay the specialist at the time of service, because the specialist doesn't have a lot of relationship with the patients like we do. But because we're kind of their general dentist, they come to us for checkups all the time. A lot of times they'll try to, well, can I make payments on that? You guys know who I am. I'm good for it. And so sometimes if I have those patients, I'll refer them too, if I know I'm not just I don't want to do the work and not get paid.
Well, you don't just do everything out of the kindness of your heart.
I do not. You guys know my heart is fairly black, and I do not have a lot of sympathy for people.
I thought in our interviews for dental school, they say, why did you go to dental school? And mainly the answer was, because I want to help people.
Yeah. But I'm not sure if that was always
I don't think that
true.
was my answer either.
I don't remember what my answer was, but I'm sure it was,
I want to make a good living so I can retire someday.
Yeah. I mean, I don't want to be working after hours. I don't want to be on call all the time. Things like that.
One of the other reasons I would refer to, say, for example, even like maybe a number 8 endo would be something like, maybe I don't have time to do it in my schedule. And time is of the essence. I mean, yeah, you can, give them an antibiotic and some pain medication, get them through. Sometimes you just need to get people in and get them taken care of, and you got to kind of say, I got to let them do it.
Yeah. It's true. Sometimes an oral surgeon can get a patient in and take a tooth out in 20 minutes that you might not get them in for a week.
Exactly. Yeah. Yep. That's another reason.
All right, let's talk about a few other things here. Okay, so endo, I think we kind of agree. We refer for molar endo and some other difficult cases. Probably apicoectomies. You guys do any of those?
No, sir.
Never have.
Yeah, me either. What about pedo? What for pediatrics? What do you guys usually use? Or when do you refer for pedo? I guess what makes you want to refer?
I refer if they, cannot tolerate the procedure once it's still, something that's where it's not safe to do it. Those kind of things. We see a fair amount of kids in my office, and some do really well, even though they're pretty young. I had like a 4-year-old girl the other day that sat still and didn't do anything and just put on YouTube on the TV and some cartoon, and she checked out,
Wow.
So that was pretty good.
What about you, Marcus? When you did see children in your practice, or have seen them in the past, what was your reason for referring them usually?
Usually, if they were under 18 years old, I would no. Similar to Troy. I mean, you can have kids that are pretty young and do great, but boy, if I feel like I've got a parent that's just hovering, and if the kid can't hardly stand to sit there, to have their teeth cleaned, I'm a little concerned. How am I gonna get this patient numb and do this procedure and have it turn out well? So I just kind of watch for some of those cues when I'm diagnosing. But I've seen plenty of kids and they've done really well, but at the same time, there's just those instances where you just get a sense that this is going to be pretty challenging and I may not be able to do a very good job here, and the kid's going to have a bad experience.
Yeah, that's a good one.
So
yeah, I think
you refer on those ones with the mothers and the fathers that sit and tell Johnny that, what's going to happen and everything. It won't let you get a word in edgewise. You're going to get a shot because you didn't brush your teeth. And you're going to, and yep. There's the super helpful
You
parent.
Be a good boy. I'm going to buy you a Happy Meal at McDonald's.
Yeah, the super helpful parent.
Yeah, that's interesting. Yeah, the behavior for pedo referring usually is based on the behavior of either the patient, but sometimes the parent. So yeah, I think I may have told you guys about this when I had a kid that was like 8. He needed a pulpotomy and a stainless steel crown, I think. I can't remember, on some posterior or some maxillary molar. And the dad kept wanting the tooth pulled. And I'm like, well, you might need to keep that tooth for a couple more years. And then he starts telling the kid, oh, if you have it pulled, it's not going to hurt at all. It won't hurt at all. And a root canal, man, if they have to do that root canal on your tooth at the other dentist, it's going to hurt like really bad. I'm like, hold on there. First of all, pulling a tooth, it's not exactly painless. And a root canal or a pulpotomy is not really the most painful thing in the world either. And so anyway, that dad was just, and finally I got him to refer to terrible. What about like perio? What do you guys look for when you're referring for perio? Because a lot of times hygienists can do, SRP and things like that. But when do you refer to a periodontist?
I've generally, if it's more than a 6 millimeter pocket, in general, I've recommended referral. I never really did bone grafts or things like that. Anything that was very surgical related to perio, for the most part, I'd refer. So that was just kind of me, but there may be somebody out there who's more comfortable with it.
What about you, Troy?
Yeah, that's about the same. Anything that I kind of let my hygienist decide what they feel like they can, do in house and whatnot. And if they feel like, this one's a little too advanced, then we'll refer it out. Definitely surgical stuff, grafting, as far as like gingival grafting, all that stuff, we refer that out. So yeah. How about you?
Same thing. Yeah. Deeper pockets if the hygienist doesn't feel comfortable, or if maybe they need some, I don't know, something with a laser, something's going to require a scalpel. I'm probably not going to do that, or implants. I'll refer. Yeah. I refer my implants out. Let's see, what other specialties are there, guys? Ortho. We talked about ortho. I don't do much ortho. Yep. I'm like you, Troy.
Yep. I don't.
Prosthodontist.
Prosthodontist.
Yep.
Yeah. Yep. I don't know how it is where. I don't do any proctology in my office, but a lot of people say a dentist is about as bad as the proctologist, and I would beg to differ on that one.
Yeah. I don't even know how you can compare the two.
Seriously.
It's like, serious, what is the deal on that,
I don't know if they have
Dark stinky hole.
Whoa. We're gonna have to make this mature audience. So it's only on this episode.
Explicit lyrics on this one.
Now, do they have a rule or a law where you guys are that only prosthodontists can do like an all-on-4 type of situation?
I am not aware of any law.
Okay.
Yeah, I'm not aware of that.
I don't think it's a law. Sorry, not a law, but our malpractice insurance has said that they won't cover any general dentists doing those unless they go to like a certain amount of CE each year or they're a prosthodontist. And I mean, I don't do those anyway, but I guess there are a lot of lawsuits with general dentists extracting all the teeth, putting implants in themselves, and then doing an all-on-4, and they had a lot of issues with that. So at least our malpractice here has started to push back on that and tell us that anyone can't do that stuff.
I wonder if that's based on the fact that people are not referring, like general dentists are actually trying to do more, and they get in over their heads, and then they start, maybe getting in trouble that way, because that's what insurance companies, when they start buckling down on general dentists about stuff, it's usually because that's what they're seeing all the lawsuits from.
Yes. Yep.
Totally
agree. Yeah. And we've all probably been in those situations where we try to take a tooth out and, it breaks off. We can't get it out, and we've got to, have the oral surgeon get it out. Once in a while, those aren't too bad, but I would guess that an oral surgeon would probably get kind of sick of cleaning up our mess all the time.
Yeah.
Or, I know one endodontist I had talked to that I refer to, he said at one office he was getting only referrals for retreats. So he called this dentist up, and this dentist had kind of a little mini corporation, had other dentists working for him. And he told the endodontist that, well, I tell all my associates that they have to at least try the root canal first, and then if it fails, we'll refer it. So that seems like bad treatment to me, but I don't know. I think that's probably not in the patient's best interest.
Yeah, I would probably, hopefully, like, was it Marcus that was saying something about, having the oral surgeon on your side? Because if they start going, oh man, your dentist sucks, he shouldn't be doing this stuff, that could definitely hurt your practice.
Yeah, he broke off another third molar at 4:30 in the afternoon.
Yeah, this is the 15th one that this guy's done.
Yeah. Broke another file off in the molar, or the
he only refers
apex
when he
of
screws up,
14,
which is like
every
other day.
Yeah, which is all the time.
Which is like all the time with this guy.
Is there?
But that also
is there
gets
anything
to like kind of the point of ethically, like the challenge that you have when you're a general dentist and you can do anything, is just trying to figure out that level of when you do take stuff on, when you should refer. I mean, because everybody's got to start somewhere, and heaven knows we're in dental school. We don't come out of there like prepared to do everything. But ethically, we've got to try to do the best thing we can for the patient, and we can't. I don't know. We have to balance that need to stay busy, that need to take care of a patient, that need to refer, and that's a hard thing.
It is, because you want to believe that you can do it all, and I think I can't remember who said it when we were in dental school, that the people who finish at the bottom of the class are usually the ones who make the most money, and I wonder if that's because their ethics aren't that good and they're trying everything. I don't know. Is that
maybe.
Is that a derogatory statement of some kind? I don't know, but against the people in the bottom 10% of the class, I don't know. But I thought that was interesting.
It is hard.
Is there anything?
Because if you're stressed out, you're not making as much as you want. Insurances, of course, have got us all stressed out, and referring gets less and less interesting as you need to keep that in house, and you may end up starting to do stuff that you're just not. You shouldn't be doing, and you don't want to refer because you need to make the money off of it. I don't know.
Well, if you have a 2-hour hole in your schedule and somebody comes in with a toothache on number 3, you're thinking, well, I've got the time, I might as well try it. I think that's where you could get in some trouble. It's not worth that, I don't think. Is there anything you guys notice that patients really push back on, like referral wise? Like if you send them to, like I get people who sometimes complain about, then I have to send them to the oral surgeon for their wisdom teeth. Oh, you don't do that? No, I don't do that. But most people are like, okay, I know I have to go to the oral surgeon for that. But is there anything you guys really get pushed back on specialty wise when you refer from patients, at least?
I would say oral surgery and molar endo would be the two for me. Same thing with I don't do surgical extractions, and the nice thing about now we have I have my business. One of my business partners does a great job, and he can sedate them and all that stuff. So it's been very nice because then I just say, hey, I'll help you out here and put him in his schedule, and patient's happy, everybody's happy. So that's nice. But molar endo, still no, I still refer that. I just try and explain to them why I'm referring them so they don't, think that I'm not trying. It's not like I'm trying to punt the thing off. It's just that I have to nicely say I'm not capable of doing it. I don't like molar endo. Never really learned really good how to do it, and don't really want to learn.
There are too many variables in a molar endo, I think.
Yeah.
And even if they look like they're done well, they might come back to get you in a year or two. What about you, Marcus? Is there anything you've noticed that patients really push back on when you want to refer?
I'd say maybe surgical perio. Like not so much like you're going to go to a periodontist who does implants, but like you look at it and you say, you've got bone loss, you've got, the pockets are too deep. We can't effectively treat that with SRP. Just, I think because a lot of times it's not as noticeable to patients. Yes. They've got a 7 millimeter pocket. Maybe it doesn't hurt, maybe it bleeds. They're just so used to things bleeding, but it doesn't really hurt, and I don't know. It just seems like getting them to go to the periodontist to have periodontal surgery to save their teeth. It feels like I get more pushback from that. Yeah,
that's a good one. Yeah, I think.
Great point.
Those are probably my top three: endo and oral surgery. You don't pull teeth. No, well, yeah, I pull some teeth, but I really don't like to pull that many teeth. And so you're going to go to the oral surgeon. But yeah, perio is a good one. Yeah, it doesn't usually hurt. And they're like, well, why can't you clean my teeth? Can I just have a normal cleaning? Nope.
So, because you got crap below the gums, man. You have to explain that to them. And that's true, Marcus, because, pain motivates people. Usually with oral surgery or endo, they're in pain. So they kind of they'll do something about it. But perio, that's the silent killer.
It's true.
It's like deadly.
It's like half the time they don't even know they got it. Unless their wife tells them, or something like, man, my wife's complaining I got really bad breath.
Yeah, you do, dude.
You go, well, yep. Yeah.
You probably have high blood pressure too.
Yeah. But that's one of those things that if they're not in pain, they aren't motivated to go to the specialist.
It's true. Yep, it's true. And even sometimes then they don't go. I don't, whatever.
I have had a lot of people come back from the periodontist after having the initial consultation, finding out how much it's going to cost.
Yes.
And nope, not going to do that. So they end up back in your office for regular perio maintenance or whatever, and you're kind of like going, what are you doing, man? You need to go back over to the perio. And they're going to charge me $5,000. And how many times you hear that?
Yeah. Do you guys ever have, I'm sure you do, you refer a patient to a specialist that is a high quality specialist, but then they say, oh, they were too much, so I went over to either this specialist that you have no relationship with, or they'll go to a general dentist and get their root canal. I had a lot of that probably starting off, like, we need a root canal. Well, I found this other dentist who will do it for me. And so I had to start having conversation about that. Well, he's not a specialist. It's going to, you won't have as good of outcome, things like that. And then, sometimes, I don't want to root for things to fail, but when you tell them it failed and then they're going to have to go to a specialist, sometimes that does feel a little, I don't know.
Yeah, a little bit of, I told you so, kind of feels good sometimes.
Yeah. Like I was vindicated or something like that.
Self-fulfilling prophecy.
Yes. But I sometimes I get that. Well, my insurance, that specialist doesn't take my insurance. Well, yeah, they do. They just aren't in network. And there's a reason this other person is giving it to you cheaper, anyway.
That does happen. That's a good point too, is when, you have certain specialists that aren't on certain insurance plans. So you refer to an endodontist, they come back from another endodontist that, accepts their insurance, and you're like, what? Yeah. And then and I understand that. That's, but most of the time I don't know what insurances they take anyway. It's like not like I say, call them, hey, what insurances do you guys take?
Yeah.
No, I don't either.
That's something that between them and whatever they want to do for their business practices, right?
Yeah, I do have people. Well, I got to find one that takes my insurance. That's fine, but you might want to spend $200 or $300 extra just to get it done right. And so I've been trying to. I feel like I have to sell them on that sometimes. Which, anyway.
Yeah.
So, whatever.
Yep, for sure.
Yeah. Well, any other little tidbits you guys want to throw in here?
No, I don't think I have any more wisdom. I'm plumb out.
You want to refer our listeners to any other dental podcasts or anything like that? Nope,
there's really nothing.
Let me just stop you right there.
Quality out there. This is it.
We are the specialists of dental podcasts.
Dental podcast. We keep it real here on Dental Realist.
That's right. Okay. Well, let's see. Marcus, do you want to tell them where to find us if they don't know where to find us out there in the wild?
You can find us on all the great social media channels out there. We'd love to have you follow us on social media. If you've got questions or comments about any of our podcasts, you can reach us at dentalrealist@gmail.com. You can download our podcast wherever fine podcasts are sold or free. We've also got a couple of books out there that are quick, easy reads if you like to read stuff. So you want to be a dentist, and so now you're a dentist. Those are our 2 books that are out there.
Yep. Cool. All right.
Fantastic. Yep.
Well,
until next time, right?
I feel like this is a good one. Yeah. We appreciate everybody listening from the United States, France, and everywhere else. And this has been the Dental Realist Podcast, and we will talk to you on the next episode. Thanks.
Bonjour.